So my presentation is on chlamydia. A little overview: chlamydia is a sexually transmitted disease, or commonly shortened to STD, and it's caused by infections of the bacteria Chlamydia trachomatis. Here's a little picture of that, along with the cell, the host cell. It's commonly just known as chlamydia, and it affects mostly young women, but it can occur in both men and women at any age group. A little bit more about Chlamydia trachomatis. It's gram-negative and aerobic, meaning it needs oxygen. Typically coccoid or rod-shaped, and it is intracellular pathogen, meaning that it replicates inside the host cell. Chlamydia trachomatis comes from the family Chlamydiaceae, and it was related to chlamydia pneumonia. Chlamydia pneumonia causes respiratory diseases and is linked to diseases such as pneumonia, obviously, bronchitis, atherosclerosis, and multiple sclerosis. Here's a picture of them under the microscope. As you can see, the arrow is pointing to the bacteria. A little more detail: it cannot synthesize its own ATP. It cannot be grown on an artificial medium. And this little picture here is a good depiction of the mitochondria and how the elementary body, both the forms, elementary body and reticulate body, that we'll discuss later, uses the host mitochondria to create its own ATP. There's a unique cell wall that was thought to be once a virulence factor because it inhibits phagolysosome fusion in phagocytes. And this is why it was once thought to be a virus, because of the characteristics such as the use of the mitochondria of the host cell to replicate or to make its own ATP. More on the cell wall. The cell wall contains liposaccharides, a liposaccharide membrane, but it lacks peptidoglycan. So with this, so as you see here, this right here is the lipopolysaccharide, and there are cytosine-rich proteins that are present instead and act as like the functional equivalent of that peptidoglycan. And the unique cell wall actually allows for intracellular division, which is division inside the cell, and then extracellular survival as well. Thirdly, the replication process with, as we were talking about earlier, the unique life cycle alternates between two different modes: the non-replicating infectious elementary body and the reticulate body, which is replicating but non-infectious. So the elementary body is the dispersal form of the pathogen, and when it makes contact with the host, it induces its own endocytosis. And the elementary body then interacts with the glycogen within the cell and then converts to its reticulate state. And within that reticulate state, it divides every 2 to 3 hours and has an incubation period of 7 to 21 days. After that division, the pathogen reverts back to the elementary body or state, and it is released by the cell through exocytosis, and then the cycle repeats. As you can see here, this is the first mode, being the elementary body, and it'll induce its own endocytosis, and then through that it'll replicate. Here it's in its reticulate form, and so on until the cycle repeats. So signs and symptoms in both men and women can be different and are different. Discharge from the penis is in men. There can be a burning sensation while urinating, which is both common in males and females. There can be a burning or itching around the opening of the penis, and pain and swelling in one or both testicles. In women, as we said, it can be painful urination or burning sensation while urinating. There may be abnormal vaginal discharge, pain during intercourse, or abnormal bleeding between periods or after intercourse. As you can see here, this is a chlamydia discharge. Maybe there's an example of an eye infection and a chlamydia throat infection. Here's a little infographic of the differences between men and women. There may be severe problems that may occur if left untreated. In women, infections can spread to the uterus and fallopian tubes, causing pelvic inflammatory disease, or PID. There may be infertility, which is more common in women than in men. And there may also be complications of pregnancy, such as with ectopic pregnancy. And left untreated, that can lead to severe health problems in regards to the mother. Men typically don't display health problems, but if they do, the epidermis can be infected, which may cause a pain, fever, or rarely infertility. In both men and women, there can also be a reactive arthritis, which is an arthritis that is caused by chlamydia left untreated. Can this affect newborns? Yes. Babies born from infected mothers can have eye infections or pneumonia from chlamydia. And there may be a high likelihood of chance of premature birth. And as you can see in this picture, the pus and the residue here from the eye infection, the infant is affected by the infected mother. So thankfully, treatments are pretty straightforward. Antibiotics can easily cure chlamydia. There are single-dose antibiotics and a 7-day course antibiotic for more severe symptoms. For the single-dose, patients should not have intercourse for the next 7 days, while for the 7-day antibiotic course, patients should not have intercourse until treatment is complete or symptoms are gone. And this is because to reduce the spread of the disease, we should make sure that it's completely gone, and this is a good standard safety measure to do so. Repeat infections are common and should be treated accordingly, and repeated infections also produce a more highly likelihood of chance of getting infected if you are repeatedly infected. And that's why treatments should be treated accordingly. So right here, this is an example of an antibiotic, azithromycin, I believe. Sorry for the pronunciation. Risk factors that may influence higher likelihood chance of infection is being sexually active before the age of 25. Obviously, the longer you're sexually active, the easier it is to be infected with chlamydia. Also, in terms of age, it's more likely that you are to be infected. Also, having multiple sexual partners, obviously, the more sexual partners you have, the higher likely of chance you encounter someone with chlamydia, and the higher likelihood of chance you may contract the disease. Not using a condom consistently is a good indicator that you may get chlamydia, because that contraceptive is good for the prevention of STDs in general. And if you have a history of STIs or sexually transmitted infections, you may be at more of a risk of getting infected. So, prevention. Use of male contraceptives, specifically condoms, as we were saying before, is a good way to prevent the transmission of chlamydia. A limited number of sexual partners will reduce your likelihood of infecting or getting infected by chlamydia. Getting regular screenings will help to prevent the disease from developing more. With the infographic here, as you can see, screening allows single-dose treatment if detected early, while no screening may make you unaware of that you have chlamydia because of the asymptomatic things of chlamydia, and this may lead to infertility, risk of infection to others, or pregnancy complications. Although if you're asymptomatic, it's most likely that you won't develop these other symptoms, but it could happen. Avoid douching because it can decrease the number of good bacteria in the vagina, meaning just cleaning of the vagina and the area around it regularly, which could decrease the good bacteria. Diagnosis can include multiple tests, but the most accurate and most prominent one is the nucleic acid amplification test, or the NAT test. It's the most sensitive one, and for women, vaginal swabs are used, and in men, urine is the optimal sample. It can be self-collected, and usually patients do prefer that, and it is less invasive, so that's why one benefit to the NAT test. And it works by detecting the genetic materials such as RNA or DNA of bacteria, Chlamydia trachomatis. Here's a picture, and here's like a cotton swab version. Chances are, for young people, 2/3 of new infections occur among ages 15 to 24. And this is for biological reasons as well as habitual reasons and like maturity, habits in general. Estimates show that 1 in 20 sexually active young women ages 14 to 24 have chlamydia, and the chances of having or getting chlamydia from someone that actually has chlamydia is 30% to 50%. There's an estimated 10% in males and 5 to 30% in females that confirm symptoms, but most will have little to no symptoms at all. Lastly, a little history. It was discovered in 1907 by Halberg von Prowazek. I'm sorry if that name is pronounced wrong. He studied and observed through the experimentally infected orangutan. It first was recognized as an STI in the 1970s, but took until 1988 for it to be notifiable. Numbers rose steeply in 1995, reaching 100,000 in 2003, compared to only 34,000 new diagnoses in 1990.